Whether it's on the USMLE or in the wards, you need to be able to break down lab values like this. So in today's case, let's go through hemolysis. All right, first let's start with the basics, hemoglobin. If it's low, like in this case, we have an anemia, and now we need to classify it. Is it microcytic, normocytic, or macrocytic? And for that, we need to look at our MCV, which here it's between 80 and 100. So we have a normocytic anemia. Maybe this is due to acute blood loss or hemolysis. So let's go to step 3. So step 3, take a look at the reticulocyte count, which is a measure of your bone marrow response. Now here, since it's elevated, that means we actually have a good bone marrow response, meaning it's producing reticulocytes in response to either a hemolysis or an acute blood loss. Versus if you have a low reticulocyte count, you might be thinking bone marrow failure, like aplastic anemia or myelofibrosis. Now step 4, look at your LDH, which is a tissue breakdown marker of the RBCs. And so if it's high, like in this case, that just supports hemolysis. All right, so up to this point, we can say we have a normocytic anemia, likely secondary to hemolysis. Now, is this hemolysis occurring intravascularly within the blood vessel or extravascularly, like in the liver or spleen? Next, let's go through some clues to help us distinguish between the two. So step 5, take a look at haptoglobin, which is a scavenge protein that binds hemoglobin within the bloodstream. And so if levels are very low to undetectable, then you're thinking intravascular hemolysis, versus if it's low to normal, like in this case, you're thinking extravascular hemolysis. Now, step 6, look at your bilirubin pattern, which here we have clearly an indirect hyperbilirubinemia, which again supports extravascular hemolysis. Now, in our final step, we need to determine what is the cause of our extravascular hemolysis. And for that, we're going to get a peripheral smear, which here shows spherocytes. So you might be thinking hereditary spherocytosis or warm autoimmune hemolytic anemia. But to distinguish between those two, you're going to get a direct Coombs test, which here is positive. So we are thinking warm autoimmune hemolytic anemia.